several of these follicles they begin to enlarge, and a cavity is formed around the ovum. And this is called antrum formation. This cavity, when it is formed, it is called antrum formation. And when the cavity forms, these follicles, they are now antral follicles. This cavity which is formed, it is filled with follicular fluid. Now what happens is that from the sixth day of the cycle, one of these follicles, it begins to grow rapidly, and this follicle now becomes the dominant follicle, whereas the remaining follicles, they undergo atresia. And those follicles which undergo atresia are called atretic follicles. So is this clear so far, the students?
Yes, ma'am.
अभी तक मैंने क्या बताया, कोई एक आप में से बता सकते हो? Any volunteer? क्या सुना आप लोगों ने? जी, any volunteer?
Ma'am, basically what you meant was that at the time of birth, there are a lot of primordial follicles that that are formed, but these like the total amount of follicles that are to be made, that is about 1.2 million, they are formed at the time of birth, and they stop they stop the process at puberty. They begin again, like the process at the stage that has stopped begins again, and only one follicle is able to mature while the rest become atretic.
Partly you are correct and partly you are missing things. So I will repeat for you people that this is true that from the time of birth there are many primordial follicles. And where are these primordial follicles present? They are present beneath the ovarian capsule. And each of these follicles at that time contains an immature ovum. Remember, it contains an immature ovum. Now, when the cycle starts, and obviously this occurs at the time of puberty, several of these follicles, they begin to enlarge. And a cavity is formed. This is important, that a cavity is formed around the ovum. And this cavity is filled with follicular fluid. When the cavity is formed, now these follicles, they are called antral follicles. Now, this was happening from the start of the cycle. But what happens from the sixth day of the cycle? That one of the follicles, it begins to enlarge rapidly, and the remaining follicles, they become atretic. This is happening from the sixth day of the cycle. And those follicles who undergo atresia, they are called atretic follicles. And the follicle which outgrows the remaining follicles now becomes the dominant follicle. Now, this is interesting that why one of the follicles becomes the dominant follicle. What is so special about this follicle that it dominates and it increases in growth? It is said that this is because of the ability of that follicle to secrete estrogens, the result of which this follicle, it outgrows the remaining follicles and it attains the final maturation. And this estrogen is being secreted in the follicular fluid. Now, what is the maximum size that is attained by the dominant follicle? Any guess? Students, the dominant follicle reaches its maximum size. And what is that?
No idea, ma'am.
The maximum size that a dominant follicle should attain is 18 to 20 millimeter. Now, this dominant follicle, when it attains its maximum size, this follicle is now called the Graafian follicle. And the structure of the Graafian follicle is such that it is lined by theca interna and theca externa. Now, cells of the theca interna, they are basically the primary source of estrogens. I told you that the reason, probably the reason, or the thought behind one of the follicles attaining the maximum size is the ability of that follicle to secrete estrogens by the follicle. But the main source of circulating estrogens coming from the ovaries is the theca cells of theca interna. Is this clear so far?
Yes.
Now, after it has attained the maximum size, and this is taking place around about the 14th day of the cycle, what happens is that this ruptures and it releases the ovum. And this ovum is released into the peritoneal cavity. Now, what is the fate of this ovum? This ovum is picked by the fimbrial end of the fallopian tube. If you remember your anatomy, that fallopian tube has 4 parts, and the most distal part is the fimbrial end. So this ovum is picked by the fimbrial end of the fallopian tube. And what is the fate of this ovum once it is picked by the fallopian tube? Either this ovum gets fertilized by the sperm in the fallopian tube, and this happens in which part of the fallopian tube, this fertilization?
Ampulla.
Sorry, in which part?
Ampullary part.
Ampullary. So this is happening in the ampullary part of the fallopian tube. If it gets fertilized by the sperm, then this fertilized ovum, it traverses the fallopian tube, it gets embedded in the uterine cavity, and the process of pregnancy continues. But if fertilization doesn't take place, then this ovum, it is extruded out through the vagina. So after this release of the ovum, what is the fate of the follicle, or what are the changes that take place in the follicle? Because I have talked about the ovum which is released, but now what is happening? What is happening in the follicle once the ovum is released? What happens is that after the release of the ovum, the follicle, it gets filled with blood. And once it gets filled with blood, now this follicle is called corpus hemorrhagica. And when, remember that once the ovum is released, or at the time of release of the ovum, there may be slight bleeding into the peritoneal cavity, which may cause irritation. And rarely the hemorrhage from the side, it may be so severe that the patient or the woman, she may present with hypovolemia, but that is extremely rare, extremely rare. In most of the cases, majority of the cases, the release of the ovum is an uneventful process. So the cavity of the follicle, it gets filled with blood, and it is called corpus hemorrhagicum. Now, remember that there are cells of the follicle, and the cells lining the follicle, anybody can tell me that what are those cells? Anybody can guess that what are the cells which are lining the follicle? Students.
Ma'am, granulosa cells.
Mhm. And I've told you one layer of cells already.
Theca
Theca
cells.
cells, ma'am.
Cells. Yes, theca cells. Now, what happens is that once the ovum has been released, the cavity is filled with blood. The granulosa cells and the cells of the follicle, which are lining the follicle, they begin to proliferate. They begin to proliferate, and soon the clotted blood that is replaced by yellowish, lipid-rich luteal cells. And this follicle is called luteum. When the follicle was filled with blood, it was, and when the cells they proliferate, they replace the blood with lipid-rich luteal cells called corpus luteum. Is this clear?
Yes, ma'am.
This corpus. And this secretes estrogens. And I've also told you that causes by the and if pregnancy occurs, the hormones which are being secreted by the corpus luteum, which are estrogens and progesterone, they are important in the maintenance of pregnancy. So the corpus luteum has a very important function in maintaining pregnancy. And if this function is impaired, then there are chances of loss of pregnancy. Because this corpus luteum is responsible for maintenance of pregnancy for at least 12 to 14 weeks till the placenta forms, and the placenta takes over the function and begins to secrete important hormones which are important both for maintaining pregnancy and for nourishment of the fetus. So, do you get this point? that how important this corpus luteum is? Is this now? If pregnancy doesn't occur, then what happens is that this corpus luteum, it begins to degenerate, and this occurs about 4 days prior to the onset of menstruation. And raised by scar tissue, which is called corpus albicans. So this is what is actually happening in the ovarian cycle. Now, if you see that there are two phases of the ovarian cycle. One is the initial phase or the first phase, which starts from the growth of the follicle and ends at ovulation. And this phase of the cycle is called follicular phase of the cycle. Now remember that this phase of the cycle is being controlled by a hormone which is called follicle stimulating hormone. And this follicle stimulating hormone or FSH is secreted by anterior pituitary. And anterior, the release of FSH is also being controlled by another hormone, which is called gonadotropin releasing hormone, and or the GnRH. And GnRH is secreted by which important structure? Any guess?
Hypothalamus.
Yes, it is being secreted by hypothalamus. So you can all see this whole process is well connected with the higher centers. And for the cycle to be regulated, there should be a proper hypothalamo-pituitary ovarian axis. Only then the cycle can be properly regulated. Now, this was the first phase of the cycle, the follicular phase. Now, after ovulation and till the start of the process of menstruation is the second phase of the cycle. And this phase of the cycle is called the luteal phase of the cycle. Because in this phase, the corpus luteum is being formed. So, as the name suggests, it is called the luteal phase of the cycle. And this luteal phase of the cycle is being controlled by a hormone, again, which is called the luteinizing hormone or LH. And remember that the secretion of LH is again controlled by GnRH, which is secreted by the hypothalamus. So all this is connected, and I hope you don't have difficulty in remembering the names of these hormones because they are all they can easily be remembered because of their connection with the different phases of the cycle. In the first phase, the follicle was being, so that is why it is called the follicular phase, and it is being controlled by follicle stimulating hormone. In the second phase, corpus luteum is being formed, and that is why it is called the luteal phase of the cycle, and it's controlled by the luteinizing hormone. So this is all easy to remember. So this was all about the ovarian cycle. Any questions so far? Ji, students, any? Walaikum assalam. Any questions
Ma'am,
so far?
what day follicle ruptures and releases ovum into peritoneal cavity?
Sorry, I didn't get your question. Can you repeat?
I'm around. I'm around what day follicle ruptures and releases ova into the peritoneal cavity?
I told you that this is happening on the 14th day of the cycle.
Yes, ma'am. I couldn't
14th
hear you
day.
at that point. Thank you.
Remember, we are talking about the normal 28-day cycle. I don't want to confuse you with mentioning about those women who have irregular cycles. So we are going through what is happening in a normal 28-day cycle, so that people don't get confused. Okay. Now the second part of the lecture is that what are the different indicators of ovulation, and how can you find out in a woman whether she's ovulating or not? Because remember, it is quite possible that not all women they ovulate. Maybe some women they have anovulatory cycles. Now remember that anovulatory cycles they are physiologically also present. And at what times there are anovulatory cycles? Any guess? Students, any
Few months
guess?
after that. Premenstrual time
What does that mean,
around
premenstrual?
before
Yes,
menstruation.
not
Before
before
menopause. Sorry,
menstruation.
menopause.
There are
Menopause
two
and
important
menarche.
phases. There are two important parts of life. When two stages in a woman's life when cycles they are physiologically anovulatory. One is soon after menarche. Once the process of menstruation starts in a girl, the initial cycles they are anovulatory, and the reason is that because of immaturity of the hypothalamo pituitary ovarian axis. And as soon gradually it becomes mature, the cycles they become ovulatory. And the second time when the cycles they become physiologically anovulatory, that is when a woman approaches menopause and after menopause. When the woman is approaching menopause, obviously there are no cycles after menopause, but when a woman is approaching menopause, so a few years before the onset of menopause, the cycles become anovulatory, and this is because of regression of the ovarian function. The ovaries they begin to atrophy, so the ovarian function it begins to regress, and the cycles they become anovulatory. So these are the two stages in a woman's life when the cycles they are physiologically anovulatory. Now coming on to the indicators of ovulation, how can you find out in a woman whether ovulation is taking place or not? Now there are different methods. Some of them they are invasive. Some methods they are very simple. And this is required in those women who approach you because of subfertility or because of irregular menstruation. So you have to find out whether she's ovulating or not, because for conception to take place, the first thing that woman has is that she must have ovulatory cycles. Now there are different methods. I'll start from a simple method, but for this method, a woman must know how to read a thermometer. And this method is called the basal body temperature charting. Now, what is the basic behind this test? It has been found that progesterone is a hormone which is thermogenic. And when I say thermogenic, it means that it causes a rise in body temperature about 1 degree. So, in this method, you ask the woman to check her temperature first thing in the morning, daily. This could either be oral temperature or rectal temperature. And gradually, what she will encounter is that once ovulation has taken place and corpus luteum is formed, remember, progesterone is a hormone which is secreted after ovulation by corpus luteum. So, if progesterone is formed or secreted and it causes a rise in body temperature, then this gives an indirect evidence that the woman is ovulating. Is this clear? Is this test clear?
Yes, ma'am.
But obviously, for this, the woman must be able to read the thermometer. Only then you can ask her to do this. But another thing about this test is it is tedious in a way that she has to check her temperature in the morning before getting out of bed. So we can talk about some other tests. There is another test called detecting LH surge. Now, LH, what do I mean by LH surge is that I told you that LH is the luteinizing hormone, and this is being secreted in the second phase of the cycle. And LH surge or a rise in the level of LH hormone, it is seen about 9 hours prior to ovulation. Or in other words, LH surge it triggers the process of ovulation. So there are kits available which can detect LH surge. So if LH surge is present, this gives an indirect evidence that ovulation is likely to take place. So this is another test. I'll give you a list of all the tests and then I will tell you at the end that which test is most reliable and easy to do. Now the other test. The hormones which are being secreted, that is estrogen and progesterone, they bring about changes in the cervical mucus. So if you study cervical mucus in both prior to ovulation and after ovulation, you can find out or appreciate certain changes. Now, estrogen, which is being secreted after ovulation, it causes the cervical mucus to become thin. It becomes thin, it becomes more elastic and stretchable, and it is thinnest at the time of ovulation. And what is the purpose? These qualities of the cervical mucus, they help in ascending of the sperm. And moreover, it has been found that at the time of ovulation, the cervical mucus can be stretched as long as 8 to 10 centimeter in length. This is how elastic it becomes. Then another quality of the cervical mucus under the effect of estrogen is that when you take a thin layer of cervical mucus and you spread a slide, allow it to dry, and then you examine under the microscope, you can appreciate fern-like pattern. So these are some of the qualities of
Excuse you, ma'am, your mic has been muted.
Can you hear me now?
Yes, ma'am.
Okay. Did you get what I told you about the changes in cervical mucus under the effect of estrogen and progesterone?
Yes, ma'am.
Now, how would you know that by cervical mucus that a woman is ovulating or not? Now, you will call the woman and examine the cervical mucus in two different phases of the cycle. And this is preferably done on the 12th or 14th day of the cycle, and again on the 16th or 18th day of the cycle. Yes. So what are you going to do is that you will examine the cervical mucus of a woman on the 12th day of the cycle to see the changes in the cervical mucus because of estrogens. And then after ovulation on the 16th day of the cycle. And if you appreciate that the cervical mucus on the 16th day has become thick, it loses its elasticity and it lacks firming. It means that progesterone has been secreted. And as I've already told you, that progesterone is only secreted by the corpus luteum. And corpus luteum is only formed after ovulation. So this gives you an evidence that ovulation has taken place. Is this test clear? The changes in the cervical mucus, or should I repeat?
Ma'am, can you repeat the part about the 16th day?
You will again examine the cervical mucus on the 16th day. And what has happened on the 16th day? I've already told you that ovulation has taken place, ovum has been shed, and now the corpus hemorrhagicum and the process of corpus luteum, it begins. Once the ovum has been released and corpus luteum is formed, and corpus luteum is secreting which hormones? Which hormones are being secreted in the second phase of the cycle?
Progesterone and estrogen.
Yes. So if the cervical mucus has become thick and it has become, it is lacking firming pattern, it lacks elasticity. What does that mean indirectly?
That progesterone has been released.
Progesterone is
Progesterone has been released. And when is progesterone released? Is progesterone released in the first phase, before ovulation or after ovulation?
after ovulation in the luteal
So,
phase.
yes. So if these changes are appreciated in the cervical mucus, it means that ovulation has taken place and progesterone is being released. So is this clear?
Yes, ma'am.
Okay. Now there is another test, and that is called ovarian follicle tracking by ultrasound. And what do you mean by ovarian follicle tracking? That you follow the size of the follicle by doing serial ultrasounds. And you do these serial ultrasounds on which days of the cycle? You start from the 10th day of the cycle. You do these ultrasounds on alternate days. 10th, 12th, 14th, 16th. And you follow the increase in the size of the follicle. And I've told you that the maximum size that the follicle should attain should be 18 to 20 millimeter. And obviously, once the ovum has been released, the size of the follicle is going to regress. So if you appreciate the increased size of the follicle and then a decrease in the size of the follicle, it means ovulation has taken place. Is this clear?
Yes.
Then there's another test, and that is called mid-luteal serum progesterone levels. Now, when I say mid-luteal serum progesterone, it means which day of the cycle, which day of the 28-day cycle. When I say mid-luteal,
21st.
sorry, which day?
21st day.
Now you check the serum progesterone levels of the woman in the mid-luteal phase of the cycle. And if this mid-luteal serum progesterone is more than 3 nanogram per ml, it confirms ovulation. Because I've already told you that progesterone is only secreted after the release of the ovum when the corpus luteum is formed. So if the mid-luteal serum progesterone, it is more than 3 nanogram per ml, it confirms ovulation. Now, there is another test, that is the last test, and that is called endometrial sampling. Now remember that when these changes are taking place in the ovaries, simultaneously changes are taking place in the main cavity. Did you have your class on the uterine cycle? Did somebody take your class on uterine cycle? Students.
No, ma'am.
Class on the uterine cycle. For the moment, what you need to remember is that there are changes taking place in the uterine cavity or layers of the uterus. And what are those changes? That when there is follicular phase of the cycle, the uterine endometrium, that is a layer of the uterine cavity, that undergoes proliferative changes under the effect of FSH. And in half of the ovarian cycle, when LH is being secreted, there are secretory changes in the endometrium. So if you take a sample of the endometrium in the second half of the cycle, and if you see secretory changes on endometrium, what is the evidence? What does that indicate if you see secretory changes in the endometrium?
That ovulation is occurring.
Yes, because these secretory changes, they are under the influence of progesterone. Remember, secretory changes in the endometrium, they are under the influence of progesterone. So if you find secretory changes in the second half of the cycle in the endometrium, it means ovulation has taken place, progesterone has been secreted by the corpus luteum, and that is why you can see the secretory changes in the endometrium. Now, I've told you a number of tests which for ovulation. But ideally, there are two tests which are preferred. One is the mid-luteal serum progesterone level. And why is that? Because in this test, what a woman requires is that she has to give a sample of blood once and her serum progesterone level can be checked. So this is simple. And the other test which can be used is follicle tracking by ultrasound. That is also non-invasive. You just have to do ultrasounds on 3 or 4 occasions to see this increase in size of the follicle and then a decrease in the size of the follicle after ovulation. And remember, this follicle tracking is the preferred method when you give somebody drugs to induce ovulation. If a woman gives history of subfertility and you find out that her cycles are anovulatory and you give drugs to induce ovulation, then this is the best method that you do serial ultrasounds, look for this increase in size of the follicle yourself, and then a decrease after ovulation. And you are sure that the treatment you have given is being successful. Now, is this all clear, or you have any questions? I can repeat something is still not clear. G students. Is anything not clear? Any questions? Are you still with me?
Yes, ma'am. There are no questions. Thank you.
Okay, thank you.